Your morning coffee may not be the real problem, but the way you drink it could be quietly pushing your blood sugar higher every day. And after 60, that small habit can affect your energy, your sleep, your cravings, and even your next glucose reading more than most people realize. I'm Dr. Claire Bennett. Today, I want to show you how seniors can drink coffee in a wiser way to support steadier blood sugar, avoid unnecessary glucose spikes, and protect the routine they enjoy without turning it into a problem. Stay with me, because near the end, I'll give you a simple 5-day coffee test that can help you see whether your own coffee routine is helping or hurting your blood sugar. Not someone else's routine, not a headline on the internet, your own body, your own cup, your own readings. This is not about scaring you away from coffee. I am not here to say coffee is always good or always bad. The truth is more useful than that. Coffee can fit very well into a healthy routine for many older adults, but the wrong coffee habit can also work against you, especially if you have prediabetes, type 2 diabetes, belly weight, poor sleep, high blood pressure, palpitations, or medications that affect glucose. So before you change anything tomorrow morning, I want you to hold on to one simple idea. Coffee is only one part of the story. What matters just as much is what you add to it when you drink it, what you eat with it, how much caffeine you get, and what your own glucose readings show afterward. As you listen, think about your usual cup. Do you drink it black, with milk, with sugar, with flavored creamer, or with something sweet on the side? Keep that answer in your mind, because by the end of this video, you may know exactly which part of your coffee routine needs the most attention. Many seniors hear confusing messages about coffee. One day they hear that coffee may lower the risk of type 2 diabetes. Another day they hear that coffee can raise blood sugar. It is easy to feel lost because both messages can contain a piece of truth. Some research suggests that regular coffee drinkers may have a lower risk of type 2 diabetes over time, but that does not mean coffee is a treatment, and it does not mean every senior should drink more of it. At the same time, caffeine can temporarily stimulate the nervous system. In some people, especially people who are sensitive to caffeine, it may raise stress hormones, affect sleep, increase palpitations, or make glucose readings look higher for a few hours. That is why I do not ask, is coffee good or bad? I ask a better question. How does your body respond to your coffee in your daily routine? That question is where clarity begins. Let me give you a very common example. A senior tells me, "Doctor, I only drink 2 coffees a day." But when we look closely, the first coffee has 2 teaspoons of sugar and a generous pour of flavored creamer. It is taken before breakfast, on an empty stomach, and then it is followed by white toast with jam. Later in the day, the second coffee comes with a muffin, banana bread, or a few cookies. On paper, this person thinks they are just having coffee, but to the body, that morning may look like caffeine, sugar, refined carbohydrate, and very little protein or fiber arriving together. Then the person wonders why the glucose reading climbs, why hunger comes back quickly, and why they feel tired again before lunch. Now compare that with another senior who drinks 1 modest coffee after breakfast. The coffee has no sugar, only a small measured amount of unsweetened milk. Breakfast includes eggs, plain Greek yogurt with berries, oatmeal with ground flaxseed, or whole grain toast with peanut butter. That coffee is not floating on top of a sugar load. It is part of a steadier meal. Same coffee category, very different routine, very different blood sugar result. This is the first important shift. Do not think only about coffee. Think about the coffee routine. The biggest problem is often not caffeine. It is sweetness. Many coffee drinks today are not really coffee anymore. They are dessert drinks with caffeine added. Sugar, caramel syrup, vanilla syrup, hazelnut syrup, sweetened condensed milk, chocolate drizzle, whipped cream, and flavored creamers can turn a simple cup into something that raises glucose quickly. Even a drink that does not taste extremely sweet may contain more sugar than you realize, because the tongue gets used to sweetness over time. If you are used to sweet coffee, I do not usually recommend removing everything in one harsh step. That may make coffee taste unpleasant, and most people will not keep it up. A better approach is to reduce sweetness gradually. If you use 2 teaspoons of sugar, go to 1.5 for a week, then 1, then half. If you use flavored creamer, measure it with a spoon instead of pouring freely. This sounds small, but it matters. One casual pour can easily become several tablespoons, and if you drink coffee 2 or 3 times a day, that habit adds up quietly. Your memory may forget the pour, but your bloodstream does not. A helpful question is this: would I still drink this coffee if it were not sweet? If the answer is no, then you may not be craving coffee as much as you are craving a sweet reward. That is not something to feel ashamed about. Most people were never taught to think about coffee this way, but once you name the habit clearly, you can begin to change it. So the first change is simple. Make your coffee taste less like dessert and more like coffee again. But sweetness is only the first problem. The second problem surprises many seniors because it can happen before they eat anything at all. Some older adults wake up, check their blood sugar, and see a high number even though they have not eaten all night. This can happen for several reasons. The liver may release glucose in the early morning. Sleep may have been poor. Stress hormones may be higher. Medication timing may not be ideal. A late-night snack may still be affecting the body. Then, if strong coffee is the first thing you drink, your body may become even more stimulated. In some people, caffeine can signal the body to release more glucose into the bloodstream. Not everyone reacts this way, but some people do, especially if the coffee is strong, the stomach is empty, and the morning glucose is already high. So, if your morning glucose tends to be high, it may be worth testing whether coffee before breakfast makes it worse. You do not have to guess. Use your own readings as a teacher. For a few mornings, check your glucose before coffee, drink your usual coffee without changing anything else, and check again later according to the plan your healthcare team has given you. Then, on other mornings, eat a balanced breakfast first, and drink coffee with or after the meal. Look for a pattern, not one single reading. If coffee on an empty stomach repeatedly makes your numbers higher, or makes you feel shaky, anxious, weak, or hungry soon afterward, moving coffee until after breakfast may be a simple improvement. You are not quitting coffee, you are changing the order. And for many seniors, changing the order is much easier than giving up a habit they enjoy. A blood sugar-friendly breakfast does not need to be complicated. It might be eggs with vegetables, plain Greek yogurt with berries and nuts, oatmeal with ground flaxseed and a boiled egg, cottage cheese with tomato, or whole grain toast with peanut butter and no jam. The key is to give your body protein and fiber before caffeine arrives. Protein and fiber help slow digestion and support steadier energy, while coffee alone on an empty stomach can feel more stimulating, especially after 60. So the second change is not quitting coffee. It is moving coffee to a better time. Now there is another coffee mistake that many people overlook because it feels so normal. Coffee often has a partner. For one person, it is a biscuit. For another, it is a donut, muffin, sweet roll, banana bread, or a few crackers while watching television. Over time, the brain links coffee with a treat. Then the body expects both. You may tell yourself, "I'm just having coffee," but your hand automatically reaches for something sweet. This is important because refined carbohydrates can raise blood sugar quickly, and caffeine can make you feel more awake before your body has had steady nourishment. Then, a few hours later, energy drops, hunger returns, and you may want another coffee and another snack. That becomes a cycle. Coffee, sweet snack, glucose rise, energy crash, fatigue, more coffee, more snack. Many seniors do not realize this pattern is happening because each step feels small. But small steps, repeated every day, can create a large pattern. The solution is not to remove all enjoyment from your day. The solution is to change what coffee is paired with. If you want food with coffee, try a boiled egg, a small handful of nuts, cheese with cucumber, plain yogurt, or a few berries. Even better, have coffee after a proper meal so it does not become the doorway into snacking. The goal is not perfection. The goal is to stop coffee from opening the door to a blood sugar roller coaster. So the third change is to look beside the cup, not just inside the cup. This is a good moment to pause and make this practical. Write down one change you would actually be willing to test this week, not 5 changes, just one. Less sugar, coffee after breakfast, no muffin beside the cup, a smaller mug, decaf after lunch. A small change that you actually keep is more powerful than a strict rule you abandon after 3 days. Now let's talk about the amount of coffee, because even unsweetened coffee can become a problem if the dose is too high. More coffee does not mean more protection. Many adults hear that moderate caffeine intake can be acceptable, but older adults vary widely. Some people process caffeine slowly. Some feel jittery after one small cup. Some have palpitations, atrial fibrillation, anxiety, reflux, tremor, urinary urgency, or insomnia. Some take medications that make caffeine feel stronger or make side effects more noticeable. This is why cup size matters. When someone tells me, I only drink 2 cups, I always ask, what size is the cup? A small cup at home is not the same as a large coffee shop cup or a big travel mug. A mug can be 12 ounces. A tumbler may be 16 or 20 ounces. 2 large coffees may be much more caffeine than the person realizes. For many seniors concerned about blood sugar, 1 to 2 modest coffees earlier in the day is often more reasonable than sipping coffee from morning until evening. The afternoon cup is especially important because of sleep. Poor sleep can worsen insulin resistance, increase hunger, and make cravings stronger the next day. So a coffee at 3 in the afternoon may not only affect tonight's sleep, it may affect tomorrow morning's blood sugar. So the fourth change is to protect tomorrow's blood sugar by protecting tonight's sleep. This is where decaf becomes useful. Many people think decaf is a punishment, but I see it differently. Decaf can preserve the warm ritual of coffee without pushing the nervous system as hard. If regular coffee gives you shakiness, heart racing, reflux, anxiety, frequent urination, or poor sleep, decaf may be a wise choice. It does not mean you failed. It means you listened to your body. A useful experiment is to compare regular coffee and decaf under similar conditions. Same breakfast, same time, same cup size, same amount of milk. Try regular coffee for a few mornings, then decaf for a few mornings, and notice your glucose, energy, heart rhythm, reflux, and sleep. Your body's response is more useful than any online argument about coffee. There is one more trend I want seniors to be careful with, adding large amounts of butter, coconut oil, or heavy cream to coffee because someone online said it helps with weight loss or blood sugar. Fat may not raise glucose quickly the way sugar does, but that does not automatically make it healthy. A drink can be low in sugar and still very high in calories and saturated fat. For older adults with high cholesterol, heart disease risk, fatty liver, or weight concerns, that matters. Diabetes is not only a blood sugar issue, it is also a blood vessel issue. The heart, kidneys, eyes, feet, and brain all matter. So when we talk about a better coffee routine, we are not trying to create a huge cup of fat and caffeine. We are usually aiming for simple coffee, little or no added sugar, and if needed, a small measured amount of unsweetened milk or fortified unsweetened soy beverage. If you use plant-based milk, check the label, because some oat milks and flavored almond milks contain added sugar. So the fifth change is to keep coffee simple. Not sugary, not oversized, and not turned into a high-fat meal in a mug. Now I want you to listen carefully to this next part, especially if you take insulin or diabetes pills. This is not the part to skip. Do not use coffee to replace breakfast if your medication requires food. Some people drink coffee in the morning and skip eating because they are not hungry. If they use insulin or medications that can cause low blood sugar, this can be risky. Caffeine can cause trembling, sweating, nervousness, or a fast heartbeat. Low blood sugar can cause very similar symptoms. That means a senior may think, this is just the coffee, when it may actually be hypoglycemia. The opposite can also happen. A person may feel shaky from caffeine, assume they are low, eat too much sugar, and then spike high. So if you take insulin or a medication that can cause low blood sugar, ask your doctor, nurse practitioner, or pharmacist what to do when you drink coffee but eat less than usual. Do not guess. Coffee is not a meal, and coffee is not a treatment for low blood sugar. Follow the plan your healthcare team gave you. This matters even more if you live alone, have kidney disease, have memory changes, or have had falls. A shaky morning can become dangerous if low blood sugar is missed. If you ever have severe weakness, confusion, fainting, chest pain, or shortness of breath, that needs urgent medical attention. Coffee habits are important, but they do not replace proper medical care. So the sixth change is safety. Never let coffee hide a low blood sugar warning. Now let's come back to the 5-day coffee test I promised at the beginning. This is not a medical prescription, and you should follow your own clinician's advice, especially if you use insulin or glucose-lowering medication. But if you already monitor your glucose and your healthcare team has shown you how to check safely, this simple test can help you learn your personal pattern. On day 1, drink your usual coffee the usual way and write down what happens. Do you feel steady, shaky, hungry, anxious, sleepy, or wired? What does your glucose do if you normally check it? On day 2, keep the coffee the same, but drink it after a balanced breakfast instead of before. This shows whether timing matters for you. On day 3, keep the timing the same, but reduce the sugar, syrup, or creamer. This shows whether sweetness is the main issue. On day 4, remove the snack that usually comes with coffee, especially if it is a biscuit, muffin, sweetbread, or pastry. This shows whether the problem is beside the cup. On day 5, try decaf or half-calf, especially if you have shakiness, palpitations, reflux, poor sleep, or afternoon crashes. This shows whether caffeine is part of your pattern. At the end of 5 days, do not look for perfection. Look for clues. Which day felt best? Which day gave you steadier energy? Which day helped your glucose look calmer? Which day helped you sleep better? That is how you begin to personalize your coffee routine. This test works because it changes one thing at a time. When you change sugar, timing, snack, caffeine, and breakfast all at once, you may feel overwhelmed and you will not know what helped. But when you change one small piece at a time, your body can teach you. That is why your blood sugar readings are so valuable. Use your meter or continuous glucose monitor as information, not as judgment. If a number is higher than expected, do not panic. Ask what happened around it. Did you drink coffee on an empty stomach? Did you sleep poorly? Was there sugar in the coffee? Was there a muffin with it? Did you skip breakfast? Did you walk after eating? Patterns are more useful than single numbers. And please be careful with so-called natural sweeteners. Honey, maple syrup, brown sugar, coconut sugar, and agave may sound healthier than white sugar, but the body still sees carbohydrate. They can still raise blood glucose. Natural does not mean harmless for blood sugar. Sugar substitutes may help some people reduce sugar, but they can also keep the taste for sweetness very strong. The long-term goal is not to find a magic sweetener. The goal is to gradually need less sweetness in the cup. Many people are surprised by how much their taste changes. At first, less sugar may taste bitter. After a few weeks, the old version may taste far too sweet. That is a good sign. It means your taste buds are adapting, and your coffee is becoming less like dessert and more like coffee again. So, what does a wiser morning look like? It does not need to be complicated. Wake up, drink water, take medications as prescribed, eat a breakfast with protein and fiber, then enjoy a modest coffee with little or no sugar. If it is safe for you, a short walk after breakfast can also help your muscles use glucose. In that routine, coffee has a place, but it is not carrying the entire morning by itself. This is the difference between using coffee wisely and relying on coffee to push through a tired body. If you are exhausted every morning, needing more and more caffeine may be a sign that sleep, meals, medications, stress, or another health issue needs attention. Coffee can give a temporary lift, but it cannot repair a poor overall pattern. It cannot cancel a sugary breakfast, frequent desserts, sitting all day, poor sleep, missed medications, or unmanaged stress. Coffee may fit into a healthy lifestyle, but it cannot replace one. If your goal is to lower diabetes risk or improve blood sugar control, the larger pattern still matters most. Regular meals, enough protein, high-fiber carbohydrates, vegetables, safe movement, good sleep, medication taken correctly, blood pressure control, foot care, and regular checkups. Coffee is only one piece of the puzzle. So let's make the final plan simple. Choose plain coffee most of the time. Keep the cup modest. Reduce sugar gradually. Measure creamer instead of pouring freely. Avoid sweet syrups and pastries. Try coffee after breakfast if your morning glucose is high. Stop caffeine early enough to protect sleep. Consider decaf if your body feels overstimulated. Never use coffee as breakfast if your medication requires food. And use your own readings to learn your own response. Same coffee bean, different routine, different result. A large sweet coffee on an empty stomach with a muffin and another cup in the afternoon may work against your blood sugar. A smaller, unsweetened coffee after a protein-rich breakfast, stopped early enough to protect sleep, may fit much better. That is why I do not tell every senior to quit coffee, and I do not tell every senior to drink more coffee. I tell them to respect coffee, respect the dose, respect the timing, respect what you add, respect your sleep, respect your medications, and most of all, respect your own blood sugar response. If this explanation helped you see your morning coffee differently, leave a comment with the one change you may try first: less sugar, coffee after breakfast, switching to decaf, or removing the sweet snack beside your cup. Your answer may help another senior notice the same habit. And if calm, practical senior health explanations are helpful for you, you may want to subscribe to the channel. we talk about everyday health decisions in a clear, careful way, so you can feel more confident without fear and without confusion. Before you make your next cup tomorrow morning, pause for 10 seconds and ask 3 questions. What am I adding to this coffee? What am I drinking it with? What does my blood sugar usually do afterward? Those 3 questions can turn coffee from a mindless habit into a smarter daily choice. You do not need to fear your coffee, but you do need to stop drinking it on autopilot. After 60, the small habits you repeat every morning can shape your blood sugar more than you think. And sometimes, better control does not begin with a dramatic diet change. It begins with making the cup you already drink every day a little wiser.